Good Saturday morning, everyone, and welcome to Inside Sports Medicine. Dr. T.O. Souryal here, your host. How can a lead story be anything else other than USA Soccer? I mean, I'm wearing my
I got into radio by
soccer
accident. A young lady knocked on my door about 14 years ago saying that she represents a new radio station. Would you like to advertise? I told her that doctors don't really advertise, but I do have an idea for a show. And I said, look, there's so much misinformation out there. A lot of the press don't even know the difference between a sprain and a strain. I want to do a radio show where I take phone calls, moms and dads, coaches, athletes can call in, ask me questions, and I'll give them the answer from a sports medicine specialist.
That's an absolutely great question. I suspect he's always had Marfan syndrome.
I hope that if you listen to Inside Sports Medicine, you will gain accurate information and be entertained while we're doing it. You may have a question about your ankle. I think it's a bit more entertaining if you know that it's the exact same problem that Yao Ming has or Tony Romo has. And the beauty of Inside Sports Medicine, we can talk about your problem and use them as examples.
Dr. T.O. Souryal here, your host.
I've done surgery on multi-million-dollar athletes. And yes, I do get a little nervous at the scrub sink before I walk into the OR. But I really get nervous every Saturday morning before we get on the air because I don't know what's going to happen. I don't know who's going to ask me what question about what, and I hope that I can give them the right answer.
An antibiotic, Cipro in particular, that is associated with tendon damage.
I'm honest with my patients. I'm honest with my listeners. I do take care of an NBA team, the Dallas Mavericks. I am president of the NBA Physicians Association. All of these things, while they're really nice titles, they allow me the benefit of knowing what I'm talking about.
First things first, let's make sure you've got an accurate diagnosis.
When I say Jose Calderon's broken nose responded this way and we went back and forth on whether he should wear a mask or not, I'm probably the only one that can make that statement. And when you take that and translate it to radio and talk about your son and daughter's broken nose or your kid's hamstring injury or your own hamstring injury, it just brings a lot of authenticity to the answers. Hopefully we can continue for another 14 years.